Bonjour tout le monde. Welcome to another snippet on what pharmacists do. In these videos, we highlight the various roles that pharmacists play in the healthcare team and try to inspire you with these amazing pharmacist stories. Today, I have with me Dr. Tala Zahidikia. Tala is a graduate of Touro University, California, class of 2019, right before the pandemic hit. She completed her PGY1 postgraduate year one residency at Northbay Healthcare, where she's currently employed as a clinical pharmacist. Welcome, Tala. Thanks for coming on.
Hi, thanks for having me. Bonjour.
Bonjour, bonjour. Oh, look, you got some French going on. That's amazing. Okay, all right. And I need to mention that you are mom to 8-year-old Ari, and she's 8, so you had her way back throughout your academic career and now your professional career. And I just wanted to say it's so commendable that you were able to pull through and raise a young girl and a family through school and work and the pandemic.
Thank you.
It's been crazy. So Tala, can you tell us a little bit about your career path from like when you chose to pursue pharmacy as a career to getting into pharmacy school, residency, up to where you are today?
Yes. So when I came to the States, I started working as a pharmacy clerk at a Long's drugstore.
Man, that was a long time ago. I don't think lungs exist anymore. Okay,
Yes.
go on.
After a few years, I was able to get my pharmacy technician license through the PTCB organization. I was inspired by my pharmacist, just standing by the consultation booth as I'm ringing up customers, seeing what a huge impact my pharmacist had on the community on daily basis. And it was so inspiring to me that I decided, okay, I want to become a pharmacist. So I applied to undergrad and I got my Bachelor of Art in microbiology. Then it was from there I came and I was like, okay, I'm gonna start working as a pharmacy technician and apply to pharmacy school. However, I had my daughter. I got married and I had my daughter, so I decided it was a huge transition for me.
Of course,
I decided to stay the first year with her, given I don't have family here to take care of her. And after I settled down, I was like, okay, so now I'm gonna apply again. I applied to pharmacy school and I found Touro had that 2x2 program, which worked perfectly for my family. After going there, before applying to pharmacy school, I was only exposed to outpatient setting and an outpatient pharmacist. So once I start pharmacy school during my rotations, which at Touro, we get 11 rotations. It's amazing. I'm more like a hands-on learning, applying the textbook.
That's why I love it too. Yeah.
So I was exposed to many different settings of what pharmacists can do with the pharmacy and how they can have a positive outcome on the patient healthcare.
Yeah, and that's why I like to do these videos too, because many people don't know. They always think of pharmacy as the outpatient setting, Walgreens, Longs, drugs kind of setting. So that's why we do this, right? So we can just show different ways that pharmacists can contribute in the healthcare team. Sorry to interrupt you.
No, right. That's right. Like, okay, so it wasn't until my acute care rotation and I saw like, wow, I'm really gravitated towards how instantly medication work in that setting and how it just resonated with my personality. This is gonna make me so happy to go to work every day at this kind of setting. So I decided to become a clinical pharmacy in the acute care setting. And for that, I realized residency would be a good option to give that foundation that I wanted to build up on it. And I was fortunate to have my PGY1 at Northbay, and it was right.
What's the percentage of matches these days? 30%? So go girl. Yeah, you matched at Northbay.
Yes, and right, I was in the middle of my residency. That pandemic hit.
Yeah. Oh my God. Yeah.
Yeah. So things just had it was a change of turns of events, is that what they say? Yeah.
Yeah,
So
one thing after the other. You were going with the flow at that point. Things were changing so fast. You're adapting. There's a shortage of PPE, but you need PPE.
yeah.
New medications coming out all the time, and you're a resident. You're supposed to be a resident. You're supposed to be learning, but it's an
Yeah.
environment. It's a time period where everybody's learning. Even the doctors, the pharmacists that are training you, everyone's learning.
It
Yeah.
was so unknown, and
Yeah. So
so many
much
things,
unknown.
like
Yeah.
I mentioned, shortage of PPE. Because of that, electives got canceled. Like many pharmacy students didn't get to go on rotations during that time. Also, it was all in the Zoom. So yeah, I started staffing a lot, and I was so lucky that they take me as on call right before the hiring freeze and all that happened.
On-call pharmacist?
Yes, on-call
Yeah.
pharmacist. So I decided to just grow more and learn more and get more exposed. I asked them to give me the opportunity to train for different roles, transitional care pharmacy, anticoagulation, night shift, ICU, anything. And I was so lucky that they provided that opportunity to me to grow. So I just took every possible shift I could. And from there, it was like, okay, I'm learning night shift, day shift, anticoagulation, this and that.
Wow. Wow.
Yeah.
You're a jack of all trades, doing everything.
So that became kind of foundation that I was like, okay, I feel like now I can get the full-time. And they provided the full-time position, which again, I'm very grateful for.
Which you're on now. So now you're full-time.
Yes.
Congratulations. I'm so happy for you. So you're a full-time clinical pharmacist now.
Yes.
All right. Give us some example, a couple of examples of what you do as a clinical pharmacist.
So as you know, we do many things, but just to list a few in orders, like as drug experts, we look at patient's age, gender, renal or liver function, and allergies. And then based on all those, we go, okay, medications. The physician put the medication in, and we look at it. Is it the right dose? Is it the right treatment if the patient's female or pregnant, breastfeeding, or just based on the allergy, and is it intolerance, is it true reaction?
You assist the medical team in that way.
Exactly. So kind of like a police,
even simple things like you mentioned allergies. I was doing infectious disease rounds one time, and the patient had a history of penicillin allergy, but I noted that they had successfully taken ceftriaxone, which is another penicillin type medication. And I went and just put a comment in the allergies that tolerated ceftriaxone, and the ID doctor really appreciated that, because he says it helps when they're making decisions on what therapies to go with for a patient, to know that they tolerated a certain type of antibiotic and they're able to go and proceed with ceftriaxone, for example. Something as little as that is much appreciated by the medical team, and that's things that we pharmacists are very good at paying attention and documenting, right?
Right.
Yeah. Great. The one important thing too, what advice do you have? What would you advise people out there who are interested in pursuing a career in pharmacy, or even considering residency, or interested in a clinical pharmacist position? Do you have any advice for them that could help them move forward in that direction, or kind of improve their odds of pursuing their goal?
Yes, I mean, reflecting on my own journey, I would say, stay open-minded, and if try to expose yourself to that setting, see if that's what you really want to do as your career. And you make that once they make that decision, I would say just stay flexible and roll with the punches. It's not really like a straight linear line for everybody. As my own journey, I had to take a break, have my daughter, go back, and then pandemic happening, as I mentioned, all those stuff. Just stay open-minded, flexible, and just take opportunities. Stay open-minded, like whatever,
Oh man, that's a great advice, Tara, being open-minded and flexible, because maybe working as a clerk like you were, like I was, because I worked as a pharmacy clerk too. I was just getting a job to pay some bills, right? But if you're open-minded and you that allows you to take note of that interest that you have in certain things, and that kind of also allows you to make the decision that, oh, I think pharmacy is a good thing for me. I like it, and that's because you're open-minded. And I cannot understate being flexible, because life throws so many punches at you, and you can never expect them. You don't know when they're coming or what direction they're coming from. And it's very easy to give up if you're not flexible, right? If you had Ari, and you could have just said, well, this mom thing is too hard. I don't think I need to do the pharmacy thing. I think I'm just gonna stay where I'm at now and just raise Ari and see what happens later. And with the pandemic and rotations being canceled, I don't know what I don't know if I would have been so, like, I'm sure it was like nerve-wracking to kind of say, is this gonna stop like my schooling? I mean, that was a very challenging time, but you were flexible. I'm sure people that too were flexible too in accommodating all these things for you. And you graduated and you matched, and now you have your full-time job that you really love, and you're finally the pharmacist that you wanted to be, and you're doing all those things that you wanted to be. And you said yourself, you find it very rewarding. And there's nothing more important or more valuable than doing what you love. I want to thank you again for coming on and sharing all the experiences with us. If you have any questions for me or Tala, please reach out on my Instagram page, The Rookie Pharmacist. I also have a website where you can fill out a contact form. It's therookiePharmacist.com. Until then, God bless you. I love you. Have a beautiful rest of Oh man, she's so cute. She should have been here all along. Because how long have you had her? I'm sure she was with you through pharmacy school and through Ari and all that, right?
Yes.
A very important part of the family. Thanks, guys. Love you. Until next time.
Thank you. Bye.